Hey, I'm Acton from Cary Family Dental, and I get a lot of questions about Invisalign and how it works, and I'm going to spend a couple minutes showing you the software that we use to make Invisalign. Invisalign was started around 2000, 1997 was when it was first founded, and Invisalign is a way to move teeth without having to use regular braces. And so it's been around now for going on 20 years, and every year they make some really substantial improvements on their product, and I'm super excited about the way it's working now, and we're getting really great results, better than we've ever gotten before. So what I wanted to show you today is what's called ClinCheck. Basically, it's the software that we use to design the smile and design what the teeth are going to look like, and we use it in conjunction with the company. And so the steps are, step one, we take impressions of your teeth so we get an idea of what the teeth look like. We send that off to Invisalign. They digitize the models, and then they create almost like an animation, almost like you'd see in cartoons, but step-by-step process of what your teeth are going to look in the computer. And then I can look at that with our patients and decide, hey, is that the goal that we're looking for? Is that what we want to do? I'll make changes, and then once we approve that, then they start to manufacture the aligners. And each aligner is custom made for each step of the process in each patient, and it moves the teeth just a half a millimeter or a millimeter every week or so. And in doing that, it allows the tooth to move slowly with time. So right now we're seeing treatment times lasting somewhere between 4 months and sometimes up to a year as well, wearing somewhere between 14 and 25 different trays. So it's a great process, and if you got questions, let me know. But let me show you how this works. So let me switch over to the software. So what you're seeing here is a patient that I saw yesterday, and she was just finishing up with her Invisalign case. And so what we're seeing now is what her teeth look like at the beginning. And so with the software, we're able to look in this case, just the front teeth. I can show just the bottom teeth. I can show just the top teeth. I can also rotate this and look and see what it looks like if I were looking straight up at the teeth. And once we get an idea about what that's going to look like, then we can animate. So you see down here, we can animate through each of these, and it moves the steps. Each number here is a different aligner, and in her case, we're moving her teeth 15 aligners. So it's going to take her somewhere between 15 and 20 weeks, depending on how many weeks she wears each aligner. And so you can see it goes from this to, this is where we started, and this is where she ends. And let's dig in and look specifically at her lower front teeth, because that was where she was most concerned. So you can see her lower front teeth had moved over the years. She had had braces in the past, and her canines had moved forward, and her lower front teeth had moved back and up. So if we animate that, you can see we're moving her teeth down and forward a little bit to get her a better bite. Let me move this over here. We do have the ability to do what's called superimposition, or so we can show what her teeth look like at the beginning and then where the changes are. So the blue shows where her teeth were at the beginning, and the white shows where they were. So you can see how much movement there was here. So that's how much her teeth have moved. I don't have any after pictures yet, but how it looked in her mouth was almost exactly how it looked here on the screen. There are occasionally, or almost always, we're going to be placing what are called attachments on the teeth. These are small buttons that help act as a leverage point for the aligners to move the teeth. So this is one thing that people always have questions about. They're small, almost invisible tooth-colored buttons that are attached to the teeth. I always tell people that Tiger Woods' ex-wife, she was on the cover of People magazine while she was going through Invisalign, and you could see just barely that she had some of these attachments on there. So again, I'm very pleased with the way Invisalign's working, and this is just a quick dive into how the software works and the 3D capabilities of what we're doing now. And it's only going to get better from here. Thanks a lot.